Hey guys, what's up? Corey here. Just posting the video week 10 discussion. Talking about the scenario with the lady who they always run on having chest pain, and how they handled the call and what I saw and thought could have been done differently as far as communication and how they treated the patient. I'm gonna try to answer the questions as best I can and think, and share my opinions on the questions. So the first question was, what communication problems do you see in this situation? First, I want to start with arriving on the scene. The biggest thing I saw or read and had an issue with was the EMT and talking to the paramedic and out loud and complaining about the patient at shift change and how the patient's friend overheard it. Yeah, I understand you have your patients all the time that are drug seekers, or you run all the time for the same thing. We actually had one on the other night at Station 1 where we showed up. It was a chest pain, and we showed up, and the driver was like, "Oh, we've ran them before." And I was actually on clinical, but we ran them before, and I had never run them personally. But he said, "Well, since you're on clinical and you're going to be assessing this, even though we run them, still do your full cardiac assessment, because even though he always, calls for the same thing, he could be having a situation um, at that time." And so I walked in, and but anyways, back to the EMT professionalism. Even that, you can't just walk into a house and talk to a patient like they did and said what they said as far as what is it this time or the usual, because especially with friends, that's just unprofessional, and it's not, like I said, it's unprofessional, and it's just not being kind to the patient and treating the patient with respect, and treating that patient with the code of ethics, and it goes back to how you want to be treated. And so that's what I felt about the communication. I thought they didn't talk to her respectfully. They weren't professional. They didn't talk to the first responder fire as far as, hey, just write down, jot the vitals down, and we'll take it from there. They were just disrespectful and unprofessional as far as communication, and that was the biggest thing I saw. Question two: what patient assessment and care problems do you see with this situation, and might be the consequences? As far as what I saw, how they handled it on scene, especially if she's having chest pain, they don't. Oh, and they're saying, "Oh, is it the usual?" If the paramedic's saying, "Hey, she's having some crushing chest pain," at that moment, I would have got her on the monitor, got a blood pressure, done a 12 lead, and I definitely wouldn't have walked her to the cot. I would have either brought the cot in as close as I could and lifted her up, or had her stand up and move over, or I would have used a mega mover and picked her up, because if she is having, for some reason, having a cardiac problem, or heart attack, or any kind of cardiac event, walking her could definitely cause a lot more problems. So that was a big thing. Another big thing was in the transportation. There was no. It didn't seem like there was any kind of um, things done as to make sure she wasn't having a cardiac episode or a heart attack, or a STEMI. I didn't see anything about a 12 lead. I didn't see anything about IV medications and treating blood pressure and whatnot. And I didn't even see if she was having anxiety. I didn't even see anything on there related to coach breathing, checking lung sounds, calling to give a patient report. It just wasn't professional. He didn't have good assessment done. He didn't have good treatment done prior to the hospital, and what consequences that could be called, or um, could because from the situation, she could have had a cardiac event where she went in cardiac arrest, and he totally didn't catch it because of not doing those treatments. He could have showed up, you know, he could have started walking her in her. She's having a heart attack right there. She could have collapsed right there, and another again cardiac arrest. He didn't check on the monitor. Another thing is transportation. If she's having a cardiac event and wherever it was, I probably would have had a rider with me as far as fire, just in case something were to happen, especially if she's having a STEMI right there or any kind of critical cardiac event. Another thing is if she, so this would be so embarrassing, but he shows up to the hospital, gives her a patient report, and he didn't say anything about a cardiac event. They get her on the monitor, and she's having due 12 she's having an ST elevation right there, STEMI. She's having a heart attack right there, and he brought this patient in and wasn't able to say, "Hey, this is what's going on." And now they're like, "Oh, you dumb paramedic! She's having cardiac, and you didn't let us know." And so there's a lot of consequences, a lot of critical consequences that I noticed from this, and I hope y'all caught it too, because man, this is the kind of calls that are frustrating and make EMS and pre-hospital care providers look bad. So that's my senses. I hope y'all. I look forward to hearing y'all on what y'all think. And yeah, Boomer Sooner.